This is Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. The Nigeria Center for Disease Control, NCDC, has said 22 states of the Federation and the Federal Capital Territory have reported 751 confirmed cases of Lassa fever in 2022. This number, according to the center, is apart from the 4,272 suspected cases reported so far in the country. The center also noted that at least 140 deaths had been reported so far. Nigeria has continued to witness an increase in the number of Lassa fever cases amidst a decline in COVID-19 cases. The NCDC appealed to health workers to maintain a high index of suspicion for the disease, be vigilant and look out for symptoms of Lassa fever, adding that not all fevers are malaria. Since the last outbreak of the disease in 2016, the health agency noted that there had been an increase in the number of recurring cases. The World Health Organization has said nearly 300 probable cases of children with severe hepatitis have been detected in 20 countries worldwide, with some in Southeast Asia. Health officials around the world are investigating a mysterious increase in cases of the liver condition, which was first spotted in the UK. Experts believe that a common virus called adenovirus, which has rebounded after the pandemic, could be causing the surge. As of May 1st, it was gathered that most cases of young children with hepatitis had been detected in Europe, with small numbers also reported in America, Western Pacific and Southeast Asia. South African government on Thursday retracted its earlier announcement stating that school children were no longer required to wear masks amid a surge of infections driven by two new Omicron subvariants. The withdrawal came 16 hours after the health minister dropped the requirement for school children to wear masks. In a new statement, the ministry said it was clearing the confusion created by unfortunate and regrettable human error arising from an earlier media statement about the removal of the face mask wearing by children at school. It said all people, including children, were still expecting to continue complying with COVID-19 regulations, among them wearing masks in public indoor spaces and limiting numbers of attending large events. The World Health Organization has estimated that the COVID-19 pandemic left nearly 15 million people around the world dead, resulting to 13% more deaths than normally expected over 2 years. The WHO believes many countries undercounted the numbers who died from COVID, as only 5.4 million were reported. It was reported that in India, there were 4.7 million COVID deaths. The Indian government has questioned the estimate, saying it has concerns about the methodology, but other studies have come to similar conclusions about the scale of death in the country. The measure used by the WHO is called excess death. And a new case of Ebola has been detected in the northeastern Democratic Republic of Congo, increasing the total number of confirmed cases to 3 since the country's 14th Ebola epidemic was declared in late April. This is according to the World Health Organization. The Congolese Health Ministry confirmed the 3rd Ebola case in Mbandaka on Thursday, May 5. According to the WHO Regional Officer for Africa, the 48-year-old male was a high-risk contact in the first case. It went on to say that 444 contact cases had been discovered. This is TOS Television Network and you're watching Health 54. More stories when we return. Welcome back. Authorities in Beijing, China's capital, have closed about 40 subway stations due to COVID-19 concerns, despite only recording about 50 daily infections. Since the beginning of the pandemic, China has been dealing with its worst coronavirus outbreak, with the majority of cases discovered in the country's commercial capital of Shanghai. Beijing reported 51 local infections on Wednesday, 5 of which were asymptomatic. Shanghai reported approximately 5,000 cases after relaxing some restrictions. However, New security measures have been implemented to restrict movement in the Chinese capital, with some residential compounds being locked down after infections were reported. And on Monday, the Nigeria Center for Disease Control, NCDC, reported 13 additional COVID-19 infections after 3 days of no reports. The latest update released on Tuesday morning by the NCDC indicates that the infections were recorded on Eid Day across 3 states of the Federation. With the latest figure, the total infections in the country have now increased to 255,766 from 255,753, reported when the country last recorded 37 infections 4 days ago. With no fatalities recorded, the Disease Control Center noted that the death toll still stands at 3,143 cases. And the managing director of Chevron Nigeria Limited, Rick Kennedy, has said it would continue to contribute to Nigeria's development by helping to improve the health of the citizens. Kennedy gave the assurance at an event marking the World Malaria Day. The managing director said Chevron's partnership with Global Fund is an indication of its commitment to ensuring a healthy nation. Kennedy, who also doubles as CNL's chairman, affirmed that the company has been one of the largest Global Fund corporate partners, and its partnership focuses on capacity development, initiatives, joint advocacy and communications campaigns, and other local initiatives. Dr. Moshoodiso Moeti, WHO's Regional Director for Africa, has called for a holistic approach to improve water, sanitation and hygiene on the continent. She made the call in a message to commemorate the World Hand Hygiene Day, marked every May 5. The theme for 2022 is Unite for Safety, Clean Your Hands. She said the theme focused specifically on health facilities with a call to health workers, patients and family members to unite on hand hygiene to attain a culture of high quality and safe care. That is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS TV Network on Facebook, Twitter and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS TV Network. Remember, health is wealth. So till I come your way again, to stay healthy. I am Rose Audu, and many thanks for watching.